Hey, Johnny Ballgame here. What's going on? You're not going to hire a basketball coach to fix your house up. You're not going to hire a gardener to operate on your hands. So why would you hire anybody but a solid professional when it comes to audio and visual production? You wouldn't. You're going to hire Brent Clapp. Brent Clapp Productions has a gorgeous studio, 4th Street in downtown LeGrand. I sign off on this 1,000%. I broadcast my show here every day. It's not some guy in the back room, although he once was. Brent has a qualified track record and a proven history in this business. Whatever production needs you may have are taken care of by pros, professionals. And not to mention, they're a Travel Oregon award-winning company. Yeah, stuff that they've produced has went on to win big-time media awards throughout the state. You don't have to go to the other side of the state. You don't have to do it on your own. You don't have to call a basketball coach. No. So listen to Ballgame. Brent Clapp Productions. It's where you need to be. Ha 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 ha! Hey, Johnny Ballgame here. What's going on? You're not going to hire a basketball coach to fix your house up. You're not going to hire a gardener to operate on your hands. So why would you hire anybody but a solid professional when it comes to audio and visual production? You wouldn't. You're going to hire Brent Clapp. Brent Clapp Productions has a gorgeous studio, 4th Street in downtown LeGrand. I sign off on this 1,000%. I broadcast my show here every day. It's not some guy in the back room, although he once was. Brent has a qualified track record and a proven history in this business. Whatever production needs you may have are taken care of by pros, professionals. And not to mention, they're a Travel Oregon award-winning company. Yeah, stuff that they've produced has went on to win big-time media awards throughout the state. You don't have to go to the other side of the state. You don't have to do it on your own. You don't have to call a basketball coach. No. So listen to Ballgame. Brent Clapp Productions. It's where you need to be. Ha 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 ha!
Hey, EO Alive, glad that you're here with us today. And it's always a pleasure to have the CHD updates and have Carrie joining me. And thanks, Carrie, for jumping in today. How you doing?
I'm hanging in there. It's starting to feel like fall, and I know that we are, many of us are managing school and work again, and some of us are doing it in different ways than we're used to. So definitely making some transitions this time of year, but Doing pretty good. Thank you.
Yeah. Talk a little bit about just generally how we're doing on the COVID count. I mean, the numbers look positive. I don't know, maybe comment just a little bit on how you think we're doing.
Yeah, I mean, I'm really always happy to see the numbers at the end of the week be a little bit lower than they were the previous week. So right now, because of the school reopening that we've been navigating over the last few months, and some of our schools have open, and some of our schools are doing comprehensive distance learning right now. But I've definitely been tracking the numbers on a Sunday through Saturday week. So I'm definitely going by the weeks that they're using for school metrics. So when I look at that number and it's a little bit lower than the previous week, I mean, that's definitely good news and definitely what we're going for. Some of the other data that we're tracking is test positivity, and that's basically the number of tests that were done in that week and how many of the total tests were positive. That's definitely another metric that we're looking at for school reopening for some of the exceptions that are relevant to Union County, and then also for potentially transitioning back to distance learning. Our test positivity rate has maybe been a little bit higher than we would like to see, but we're also really looking at whether or not all of our tests are coming through in the electronic reporting system. So there's kind of all of these details that can influence those numbers. So I think the bottom line is we're tracking it really closely. And I feel like right now we're definitely feeling grateful that the case counts are low, and that all of the measures that we've asked our community members to put into place to mitigate the spread are looking like they're working. And again, I think it's probably too early to tell what impact school reopening will have on those numbers. But I know that our schools worked really, really hard to create plans and put mitigations in place to keep students safe when they return to classrooms, to keep the transmission as low as possible. And so, I'm really confident that they'll be able to be successful. So again, it looks like things are going okay right now.
Good. And for those people that might not know, can you sum up what schools are doing? There are some smaller schools that are meeting, but LeGrand schools are not correct right now. Is that correct?
Yeah, that's correct. So, I would say the Oregon Department of Education put out a very lengthy document called Ready Schools, Safe Learners. And all of our school districts had to develop a plan that followed those guidelines. So there's really, really, really specific guidance in those documents, and all of our schools have a plan for implementing them. So, all of the mitigations you and I have talked about many, many times, really making sure that students and staff are staying home if they're sick, and doing screenings to make sure that we're doing our best to catch people if they are sick and keep them out of those settings. Hand washing, physical distancing, face coverings, all of the things that we're asking the public to do. They're doing very similar measures in our school settings. And like I said, I know they've worked really hard and they've put a lot of the protections in place. So we'll just see how it goes. And you said, LeGrand School District is currently operating in the comprehensive distance learning. And, I know that they'll be working hard to reevaluate that based on the metrics and get students into classrooms as soon as they can.
And just a word about testing real quick. So it seems like I saw an email come by somewhere along the line a couple of weeks ago or a week ago where I kind of got the idea that a number of tests that are available has decreased a little bit. And so we're being a little bit more selective about the people that are being tested. Is that perception right on my side?
I mean, I think in our county, we are prioritizing testing people that meet the testing criteria. And so for the most part, people that meet the criteria are people that are symptomatic and present at their primary care provider to get tested. So, I still think that there are other situations where people would get tested, but for the most part, our testing, the number of tests we're doing in our county has remained fairly consistent. Good. And like I said, I feel like we're identifying some issues where maybe some of the lab reporting is delayed, they just changed how they're reporting testing. So I feel like there might be a little bit of a lag right now. So I don't feel like all of our negatives have been reported. I feel like all of our positives have been reported, but I think there's a lag. So again, just we'll see.
Right. And I've said this many times that this is a kind of a gauge. If you're testing those people that are most suspicious of being sick, you're probably going to have a higher percentage of people that are positive just because you're testing sick people. So it's just kind of where we are. So it's not necessarily a gauge of how we're doing from a community standpoint, just because there's not widespread testing. But anyhow, we could talk all day about that, and that's been talked to death. Today, we're here for a little bit more of a specific purpose, to kind of cover the wraparound services and the people that are involved. And why don't you, again, talk about that a little bit? Tell us what the purpose of that is, and we have some special guests with us that we'll pull in today.
Yeah, so I actually am really excited about our time together today because you have heard me talk many, many times about these wraparound services that are available to people in our community. So obviously, if somebody is asked to isolate or quarantine, we want them to be able to be successful in doing that. The point is to keep them away from other people so they're not at risk of spreading the virus. So sometimes that means you need help with very basic needs, like, getting your groceries, or maybe you need a medication. You can't get to the pharmacy to get it. Maybe being asked to stay home creates an impact to your income. You're not as able to pay your utilities because you're having less income come in. So, there can be so many ways that this can impact people. And then there could also be some people that are just impacted by COVID-19. Maybe they're not actually a case, they haven't tested positive, or maybe they're not a contact, but there are, other factors that could cause them to be impacted by COVID-19. So we have been working really closely with local and regional community-based organizations to really help address the needs in our community and to really help meet all of the diverse needs of our community members. So we've been working with organizations, and I have a huge long list. It's a really comprehensive list of organizations, some that are Union County based, some that are in the region, like NEON is one, Community Connections, Oregon Rural Action, Building Healthy Families, CAN, which stands for COFA Alliance National Network, Eastern Oregon Center for Independent Living, Evalkyrie, Micronesian Islander Community, Oregon Marshallese Community Association, Chinese Friendship Association of Portland, Heart and Home Hospice, and I am sure I am missing somebody, which I hate reading these lists off because I don't want to miss any names, because everybody is so important to this effort to help meet the needs of our community during this time. So basically, I talked before about the wraparound services that are available to our community. So some of them can be food assistance. If they need food, maybe they need help with the food bank. They've never had to use the food bank before because this is a new experience for them, or they just need help accessing that. Financial assistance, like I mentioned, grocery pickup. Maybe they need health insurance, or they're a veteran and they could use some support of our veteran services. So like I said, you don't have to be in isolation or quarantine to access the help of these organizations. They're just really here to provide their services to the members of our community during this time. So I wanted to also point out that one of the things that's really wonderful is that we actually have 6 different languages available at this time. And that's part of why I have invited some of these great community-based organization partners here so they can talk a little bit about what they're doing directly. I feel like I have felt like it's been hard sometimes to really be able to represent all that they're doing for our community and represent the services that they can provide without them being here. So I'm really excited that they are here today. So I'm actually going to invite them to join us and introduce themselves. So it looks to me like they're here. Sorry, I was looking at another page, so I didn't. Right. So I got all the organization names. So anyway, there they are. So excited to have company today. And so, like I said, I'm going to let them introduce themselves. So I'm going to just start with Teresa, since she's right next to me in my screen.
Thank you, Carrie. Hello, everybody. My name is Teresa Aguilera, and I'm an outreach and enrollment specialist with NEON, offering assistance with the Organ Health Plan, as well as plans through the marketplace. And I'd like to just say my introduction in Spanish as well, because that is my other language that I speak. Buenas tardes a todos. Mi nombre es Teresa Aguilera y yo trabajo como un trabajadora de alcance y inscripción con NEON.
Awesome.
Thank you, Teresa. Dale, how about you go next?
Hi, everyone. Hi, Brett. Thank you for hosting this, Carrie, and everybody with the program. I would like to go ahead and introduce myself in my language. Yago Olip, Tignain Tel Nabu, Oregon Mayal, Machugo Lolokran, Ginan Telmage, program game, Retobian, Organ Health Authority, and Jibanka Jangilo, Nang Miyan, COVID-19.
Thank you so much, Dale. Oh, I must have lost you. I'm sorry.
Am I good to go?
Just repeat the last part of what you said, Dale, if you would.
Okay. Yeah, sorry. Somebody's trying to call me. Nagpamili ko, aram nyo test positive. Imijar, kamanchot resource available na nir ng chibang iba yung tigalap nang mijinum. Chibang kajang, igichen nang mijin. Yalang resources available, igichen chibang, food banks, ng chibang pick up delivering and memo, health insurance, veteran insurance, yung ngayon kachiduk. So yung call to kilo 541-962-1610 ngayon lale website do COVID wrap services Union County / county.org. Komortada. Thank you.
Thank you.
Thank you so much, Dale. Ramon.
Good afternoon, everyone. My name is Ramon. I am a bilingual contact tracer with NEON. I speak both English and Palawan. I'll do my introduction in Palawan as well. Ngiswal mo atro kung ang karamon aktar tigel atang walo NEON maiyokyan along sa other bilal nga Union County mawalwa County nga aktar tigel sa ML mo tong aktil mga tutuitit at kung mga yung almost spiritual tema. Okay, thank you.
Thank you so much. And I think, like I said, we have 6 total languages. So English, Spanish. Dale, will you say what language you were speaking?
I'm also bilingual. I speak Marshallese and English.
Marshallese. And I believe Ramon said he was speaking Palawan. Is that correct? So can you guys tell me what the other languages are that you have available that we're not representing here today, just so we make sure everybody knows the different languages that are available?
We also have an on-call Chuki speaker as well as an on-call Pohnpeian speaker.
Wonderful. Thank you. So again, you can see that we have a lot of resources available to us, both language and cultural needs that we can help meet all of the needs of our community members. So I'm just, again, really excited for the partnership. So what I did want to say is that I know we did our introductions, but I wanted to talk a little bit in English about the services and then give our partners an opportunity, again, to share the information about the specific services in their language so we can get that word out. So, we've talked about the WRAP services that are services the Oregon Health Authority has put into place to help individuals who have been impacted by COVID-19. So individuals or families that have been tested positive, or who have been asked to isolate or quarantine can access these services. So they can help make sure people get the information that they need. So if they have questions, not only about COVID-19, but about the resources that are available in the community so they can follow through on isolation and quarantine so that they're able to get through this time, as we've mentioned before. So there are resources available through these wraparound services that our local community-based organizations can help with. So financial assistance, food bank information, grocery pickup and delivery, health insurance, and veteran services. And the information is available and I know you have this listed on your page, so people can see this. They don't have to write it down. It's all available on the Facebook page that we're on right now. But the number is 541-962-1610. You can also email COVID WRAP services, and it's actually COVID, COVID, WRAP, WRAP, SBCS, so abbreviated services, at union-county.org. And you can also visit a great website that Neon has set up. So that's www.neonoregon.org/Union COVID-19. So again, we just want to make sure that people know that these resources are available in the community, and we want to make sure that they know that they're available in these languages, so people can really get the help they need in the way that best meets their needs. So I don't know, Teresa, do you want to go ahead and give that overview in Spanish for us?
Buenas tardes a todos. Voy a platicar sobre los servicios de RAP. La información compartida con nosotros es confidencial. Los servicios son gratuitos y están disponibles a todos que viven en el condado de Union, que han sido afectados por los efectos del coronavirus. Los servicios, hay muchos servicios disponibles. Unos de ellos son ayuda financiera, para ayuda con el alquiler o ayuda con los servicios públicos, como con las facturas de la luz o facturas del gas o también agua. Asistencia con la inscripción por el plan de salud de Oregon también está disponible en inglés y en español. Gracias.
Thank you. And I know, Dale, I think you said most of that already. I don't speak your language, but do you have anything else you want to add? Or did you cover it?
I just want to say everything's all said and done, but for the Marshallese communities, please, if you need help, and all the co-fund Nathans, please feel free to look up these websites and numbers provided. Thank you.
Thank you. And Ramon, it's your turn.
Okay, so أقادمة أيس مو أيقال رقول services provided تقل شوباي أبي غنية أيقال ذنوا ما ويب سايت nga Facebook ما أيقال social media من سبب من لو سبق like مقدون تقل إذا لو مقدون ذنوا أيقال ويب سايت من سبب من ngaya direct line meron nga sa mga tuturo nga or ngali imara atal sa help program you. Okay.
This is good. So I guess I would like to, for those of us that only speak English, and I just want to make sure that, because part of the help that can happen, I think, is for those people that speak English can maybe connect with those that need help. And so I just want to make sure that we're covering, I just want to make sure that those folks in English can direct people of other languages to the place to help if they are not connected or if they don't see this. So I guess I'd ask a general question, and that is, since I don't know what most of you said when you were speaking in another language, is there something that you need to say in English that maybe English-speaking people can help to direct those that speak another language to a place where they can get help?
Hi, Brent. This is
Yeah.
Teresa. One thing that I would just like to focus on is the fact that any information that is shared with us is strictly confidential. The services are free and they are available to anyone who lives in Union County and has suffered from the effects of the coronavirus.
Excellent. And just frankly, I mean, I kind of play the dummy in this show quite a bit because that's kind of what I am. But I try and ask the hanging questions, and to a large part of our population, just because in our daily lives we may or may not intersect with folks that do not speak English, we wouldn't even be aware of this need. And so I think this is awesome. And so this connects us together. So yeah, thank you for doing this, and thank you for. I mean, I as I'm sitting here, I'm thinking about, well, man, everybody is dealing with the effects of COVID in one way or another, whether they've been tested positive or they've been touched for it, or it's affected their workplace or whatever the case might be. But I can't imagine having a language barrier on top of that, and how hopeless some of that would be. It's like, man, I'm, I don't know, all of that stuff. Plus, I can't get the help I need because I can't communicate in a way, I can't communicate my needs. So, do any of you have any stories that maybe where you were able to assist someone or connect someone, without betraying their confidence, as Teresa said? But, has this been rewarding for you to be able to help folks through this process?
Hi, Brent. I'd like to just give one example of assistance that we offered. And for anybody who is applying for assistance, let's just say for utility assistance, for assistance in paying a utility bill, at this current time, that application is only offered in English. So if you are a non-English speaker, you may need assistance with filling out that English application, and we're available to assist with that.
Good. Anyone else kind of want to throw something in?
Yes, Brad. I would like to say something. Being able to assist people in our languages helps us reach out to our communities, and also, not being able to speak a language or understanding it does create a lot of barriers. But helping out the community who doesn't actually benefits us, because we get to build a relationship and trust and actually help them on their way. Thank you.
Yeah, you bet. Ramon, were you going to say something?
I was just going to say, I understand that some people might, calling a phone number and asking for assistance might be hard for people, but my name is spelled here in the corner. I think I'm pointing the wrong way. Here in the corner, you may search me up on social media, connect with me, and talk to me that way. If that's what you feel is more comfortable, then I can give you my phone number. I can get you the resources you need. I'm okay with putting my name out there and doing that for my community if they prefer to do it that way. Not saying that the Palau community doesn't want to contact us, but I am open to different avenues to help the people if they need that.
Yeah. Well, and thank you for making yourself available. How cool that is.
Yeah, I just want to add, I know that, we're talking about, even with COVID-19, some of the information that we're sharing with the community about, if somebody tests positive or if they're being asked to quarantine, or just the basic information about the virus itself can be pretty complicated. And so I think being able to have, even if your English is your second language and you're a fairly competent speaker, sometimes having somebody who can explain these concepts to you in your native language, I just feel like it's such an invaluable resource. And I also feel like, when we're going through a challenging time in our life, or we're being asked to do something that's really a hardship, like having to stay home and isolate ourselves for 2 weeks at a time, being able to have something as simple as a food that is, something that we commonly eat in our own culture, those are such wonderful things that we're able to offer the community. And I think that our community is really diverse. We have a lot of diverse people that live here. And so I'm just so grateful for these partners that have come together again and to try and meet our common goal of keeping people safe, slowing the spread of the virus, and helping people get through this time that we're in together.
So before we wrap up, I just want to make sure that we have kind of a full scope, because like Teresa mentioned, help with utilities. Again, it's like, I didn't even think of that, And so give us an idea of the kind of services that are available for people in need. Somebody might be panicked out there and like, how am I going to get through the next month? And I don't know. Let's just make sure that before we quit, we uncover what the kinds of things that are available for folks. You want to take a stab at that, Teresa, first?
Sure. Through the WRAP services, there are lots of different services available. There are food boxes for immediate assistance with food needs. We can also assist people and guide them to maybe where they might be able to apply for SNAP benefits for a longer term need. There's also available with utility bills. If you're asking somebody to quarantine, we want to make sure that they can quarantine in a safe manner. And so that may mean staying home for 14 days, no work. How am I going to pay my utility bills? There's available for that, assistance available for that at the senior center. We are also always available outside of normal business hours. The WRAP service person on call is available 24/7.
Awesome. Anything else someone want to be sure and add on to that? All right. Well, hey, thank you guys so much for jumping in and tuning in today. Carrie, is there anything else you want to add to this?
No, I just want to say thank you so much for our partners. And, I think I would add that we're really here to try and help with whatever people need help with, right? And so I think even, Ramon really alluded to the fact that sometimes it's really hard to ask for help. Mm-hmm. I have a hard time asking for help. And so I think that what we really want to communicate to our community is that we are here and want to help you, and that it doesn't matter what it is. If it's something you need help with, call us. If we can't help you, we'll tell you that. But we'll sure try and figure out a way to help you if we can. And that's what we're here for. And again, we've all come together and we're eager to do this work to help support people during this time. So please, please, please reach out if you need anything, and we'll do our best to try and help you, all of us together.
And I would imagine that if someone has a friend or a neighbor who they know needs help but might be, hesitant to reach out, that they could drop you an email or give you a call and say, hey, you might check in with this person and just see if there's some way that you can help them, because that's the connectiveness sometimes that is missing.
Absolutely. We all have to help each other out right now and take care of each other. So 100%. And that's why we have all these different ways that you can connect with us. So we really just are here to help with whatever we can.
Excellent. Well, hey, nice to meet you guys all. Thanks for jumping in with us. And we really appreciate you taking the time to do this. And those that are in the background, George and Holly, thanks for keeping us in line and giving us information along the way. And thank you, EO Alive, for tuning in. And always thank you to our sponsors, Grand Ronde Hospital and EONI, who make these kind of things possible. We'll see you in a couple of weeks right here on